Our government has moved too far, too fast with the easing of alcohol restrictions. This is the view of the Southern African Alcohol Policy Alliance. It says allowing on-consumption sales increases the risk of a rise in trauma cases, which puts unnecessary pressure on hospitals. Let's talk now to the Alliance's director, Maurice Smithers. Maurice, a very good morning to you. And as the Alliance, what are your concerns at the moment after this? And from what I understand, there are a lot of people who feel the same way that you do about this. It was too much too soon, but let's get your take on it.
Sure. Thanks very much. You've touched on the one point, and that is that we fear there will be an increase in trauma admissions to hospitals, because we know that in June that happened after the first ban was lifted, which caused government to have to then impose another ban in July again. But the second thing which we have learned over the months, particularly in November, December, is that social gatherings, and we would classify taverns, pubs, and so on, where people gather to drink alcohol as being akin to social gatherings. That's where super spreading can happen. Because one of the difficulties about alcohol, as we all know, is that when you've had a couple of drinks, your whole behavior changes, you get more relaxed, and the chances of people then adhering to things like keeping their masks on and social distancing and sanitizing and so on just goes out the window. So we believe it was time for the ban probably to be lifted because there was a reduction in deaths and cases, but we would have been much happier to see only off-consumption sales, possibly even with some of the on-consumption places selling takeaways, as happened after June, in June, should I say, because then at least they would have been able to make some money and not have to continue to suffer economic consequences. But at least it would have enabled the government to then assess what the consequences of that was, and then to decide at a later stage whether we should do on consumption.
So, Maurice, do you reckon then that opening up things like beaches and other places where people can go, you know, people always find a way to get their alcohol to these places or sneak them in, that might be the problem? From what I gather, it seems like buying your alcohol, taking it home would be okay. Drinking or you know, taking it away from a place that you're getting your takeaway from is okay, but not allowing it in restaurants, is that what you're saying? And probably not opening up those public spaces where alcohol could become a problem.
No, I think that beaches are not so much an issue anymore. You know, the beaches, I think, were a major issue around the festive season. Probably during, you know, the average month, beaches are not as much of a problem. Nevertheless, the police obviously have to ensure that people don't drink on the beaches. But it's much more to do, I think, with where people are, particularly indoors, where people are in confined spaces and where they're drinking together. And you know, there's endless videos circulating that show. I mean, there was one that circulated on the 28th of December where there was a tavern which was eventually closed down because of this, where there was a tavern where quite clearly people weren't wearing masks. They were all dancing and absolutely not observing social distancing, while on the television above them, the president was announcing the new ban. So, you know, I mean, we have to just accept this is what's going to happen, and we've got to. We would have preferred to see a slower, a more measured pace of dealing with the thing, based on what we've learned over the last year.
Okay, so you're not saying that this should not have been lifted at all, but just pacing it. A lot of people also saying, Maurice, that, you know, the government should have waited for the first batch of vaccines to actually be administered for us to see how that process goes, and then maybe slowly allow more and more and more to happen. So do you agree with that, that maybe that would have been maybe a month more? But on the other hand, you know, he has pressure from the industry. He also has pressure from to keep jobs in this industry as well, in this sector.
Look, it's a tough balancing act, and the fact that you know, cases were down. I mean, I think about a couple of weeks ago, we had over 20,000 cases a day. It's now down to about 4,000. Yesterday was 2,000. Deaths also a couple of days ago was down from over 800 to 200, although unfortunately last night it was up to 500 again. But, you know, when you do see that the numbers are dropping, obviously it is important to consider whether you can make some concessions. So we do believe, and we also don't believe that bans are long-term solutions. They definitely have a short-term benefit, but so we don't think it was necessarily, we understand the argument people are saying about the vaccines and seeing, but I don't think we're going to see the rollout of the vaccines happening that quickly. So I think it was okay to lift the ban, but really it should have been linked to should have only allowed off consumption drinking with the curfew and other controls in place. But more importantly also, we really have to begin to look at the future. And we're very happy that the president himself, in an interview the other day with the Sunday Times, was asked about the liquor issue and what he'd said in the January the 8th speech, the ANC's January the 8th speech. And he said, we are going to have to take measures. And he said some of those measures could be limiting or banning advertising. It could be raising the drinking age. It could be restricting operating hours, and it could be raising excise tax. Now, all of those are completely in line with what we've been promoting for years, because that is actually what the World Health Organization recommends as very powerful mechanisms to reduce alcohol harm.
Well,
and it's going to take a while. It's not going to be an overnight thing.
Yeah.
But we believe it can happen.
Well, Maurice, do you think that something like that, those measures would work in a country like South Africa, where we know, and it's been proven, that we actually have a very, very unhealthy relationship with alcohol in the country?
Well, you know, there are many countries that are deemed to have an unhealthy relationship with alcohol, and one of them is Russia. People have spoken for years that, you know, one of the sort of things that come to mind when you talk about Russians and drinking is the amount of vodka that they consume. The reality is that over the last 20 years, and this was in a World Health Organization report in 2018, in the last 20 years, Russia, through the implementation of new measures, including things like minimum unit pricing and controls around operating hours and so on, have managed to reduce alcohol consumption in that country by 43%. That is significant, hugely significant. And that's really what we need here. We're not asking people to stop drinking. All we're saying to people is, do you need to be drinking so much? And for some people, do you need to be drinking at all? And ultimately, we believe that if we put the legislation in place, and if there are proper educational programs that are being run by NGOs, by government, and so on. And I'm not talking about the industry's education programs, because those are really geared to doing the minimum to keep the industry alive. But government, proper programs by government, backed up by good legislation, we could see the same kind of change over the next 15, 20 years. You know, South Africans aren't particularly unique, you know, when it comes to challenges like this, but they're also not unique in us not being able to make the kind of necessary changes. So we believe it can happen.
All right. Well, Maurice, I suppose it's been done. It's in our hands now. The numbers will speak as to whether South Africans can control them and do their bit to keep this virus and this pandemic at bay.